Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. There are over 100 types of arthritis, but the main two are osteoarthritis and rheumatoid arthritis. Osteoarthritis attacks your joints and wears away the cartilage that cushions the two bones together, whereas rheumatoid arthritis attacks your immune system, which fights away infections in your cells. These cells could attack your heart, lungs, kidney, etc., also the lining of the joints by mistake. When you have arthritis in the knees, your symptoms could be a pain, swelling and stiffness in the joints. The knees are built up of three major bones that can get attacked. They are the thigh bone or femur, shin bone, or tibia, and the kneecap or patella. The knees have cartilages that are wrapped around the two bones of the joints that help glide along when you move. When you have arthritis, these cartilages get worn down and eventually your bones will rub together. You also have a synovial membrane that keeps the cartilage lubricated. There are three types of arthritis that can attack the knees. They are osteoarthritis, post-traumatic arthritis and rheumatoid arthritis. There are 5 stages to osteoarthritis of the joints. They are stage 0, which is a normal healthy knee. Stage 1 is minor. This stage means that you are developing the wear and tear of the joints and could feel pain. Stage 2 is mild. At this stage you may be feeling more pain and starting to feel stiff. At stage 3, moderate. You could feel pain when you run, walk or kneel down. Stage 4 is severe. At this stage, your cartilage is nearly worn away. Your knee is stiff to move, it's painful and you may need surgery. If you think you have arthritis in the knees, the symptoms to look out for are: where your bones may be rubbing together, you may feel creaking, clicking, grinding as you move. You may have difficulty, pain and stiffness when you walk. The weather can change your symptoms as well. I have osteoarthritis and when it rains or it's damp outside, my pains seem to be worse. When you walk, your knees may buckle under you, so you must be very careful, as you may fall. You may get pain that comes on suddenly or slowly progresses. Your skin at the knees may become inflamed and hot to the touch. This is called a flare-up. When you have sat for a while, and then stand, your knee may lock or get stuck. Unfortunately, arthritis can attack at any age, even in childhood. When a child has arthritis, it is called juvenile idiopathic arthritis. The risk factors could be that you are a woman. As a woman, unfortunately, you are more prone to arthritis than men. You would be at high risk if you were born with crooked joints or anomalies. It can also be inherited. If any other family member has any arthritis disease, you could develop osteoarthritis. If you have had any injuries like a sports injury, or if you are overweight or obese. If you carry excess weight, you are putting more pressure on your joints, especially your weight-bearing joints. You are at risk of osteoarthritis of the knees. The hands have over 30 bones in them, and you use your hands all the time, so your hands are at high risk. After a while, your hands may have difficulty in doing common easy tasks. There are 4 parts of your hand that can be attacked by arthritis. The thumb, where the base of the thumb is attached to the wrist. The knuckles. If you crack your knuckles, you should stop, as this may cause the arthritis. The joints of the fingers. These are both the middle and the top joint near your fingertips. When you get arthritis in the hands, it is commonly found in the following types: osteoarthritis, where it's wearing away of the cartilage. Rheumatoid arthritis. This is an autoimmune disease that attacks the lining of the joint. And psoriatic arthritis. This attacks the skin, as in psoriasis. But psoriatic also attacks the joints. When you find you are developing arthritis of the hand, you may feel early sign like a dull ache or a burning feeling at the joints of your thumb or fingers that appear hours or days after the increased activity. In the morning you may have swollen, pain and stiffness in your fingers, where you have not moved them whilst sleeping. But if you have had arthritis for a while, your symptoms become worse and more often. The dull ache may become like a sharp pain. It could also wake you up at night. The tissue that is surrounding the joint may become tender to touch and red-looking. This is called a flare-up. When you bend the fingers, you may hear grinding, grating, or cracking noises. You may not be able to do a fist, as you may not be able to bend your fingers. As they may feel very stiff, nodules may form on your fingers. There are two types of nodules: Bouchard's nodes, that are the joints at the top of your fingers near your nails, and Heberden's nodes, which are the middle finger joints. If your arthritis of the hands becomes severe, your fingers will become swollen and deformed. These look like abnormal bent fingers, where you cannot straighten them anymore. Also, the hand will become weak and unable to do everyday tasks. The risk factor of developing arthritis of the hands are if you are elderly, or if you are white. Also, as in arthritis of the knees, you could be at risk if you are a woman. If you are overweight, and it is hereditary, this means if there is someone else in the family has the disease, you are at risk. If you have had an injury, such as a dislocated finger or broken wrist joint, or if your child is under the age of 16 years of age, your child could develop juvenile idiopathic arthritis. As arthritis is an incurable disease, all you can do is to manage the symptoms of pain, inflammation, and stiffness. You can manage these by exercising a little every day. This will keep the joint moving. For example, walking or swimming. Keep to a healthy weight and have a healthy diet, such as the Mediterranean or the DASH diet, and generally, have a better lifestyle. If you want to change your exercises or medication, even your diet, you should consult with your doctor first. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.